Welcome to my podcast. Today I'm going to talk about another case which you might face. So basically, you have to introduce yourself, as we always agree, double check the patient name and date of birth. You'll have a man or a woman who's elderly, they're late 60 or mid 70, who will present to you with obviously a bumpy lesion, boggy mass in the scalp, probably on the parietal area or the vertex or on the frontal area. And you will be astonished when you see the condition. Basically, the patient might present and remove their cap or whatever, and it's quite bulky, quite big. So you start wondering, how long ago do you have this? And what did you do about it? And what do you think might be the reasons? So the patient might say that I had this lesion, obviously, a few months ago, just increased, and she might thought that it has any relation to the hair dye she used, and or she might worry and to think about that she bumped her head in a wooden hair headrest or anything that in her home, and she can't relate or link it to any other injury. And she just started to panic because obviously the lesion started to bleed, and her pillow all the time is stained with blood. And the patient says, I don't have any pain, and I'm just concerned that I would like to know what's going on. So you will ask her, after obviously knew her thoughts and her ideas, if she has any past medical history, if there is medication that she takes, if there is a family history, what sort of job does she do, and what's her lifestyle, if she lives with anyone socially, in order to know if she has any support mechanism. So the patient will tell you that I'm diabetic and I'm having high cholesterol. I'm taking metformin as being prescribed. I'm taking statin as well. And I'm taking aspirin for prevention of CVA. And then you will tell her, okay, I'm going to have a quick look. And you'll see the small, soft, friable mass. It's elevated purplish red color. It could be foul smelling, could be discharging. It could be a boogie mass full of hematoma. I remember back home I saw a lady, an old lady, being escorted by her relative, and she had a big mass in her face. And obviously, it has been ignorant for quite a long time. So in that condition, you need to build up what differential you could think of, and especially on the growth factor, if it's a rapid growth or slow across the time. So you'll think of SCC, you'll think of any other malignant cancer that could be related to this history. Then you will ask about some risk factor, like for instance, if there is any history of radiotherapy, if there is history of lymphedema, if there is a history of chemical exposure, if she has any work that related to exposure to certain chemicals. So basically, with that, you just need to build up what might be the common causes in mind. And you will ask if she has any history of headache, for instance, or high blood pressure, or there's any history. For instance, you need to ask about bumps and lumps, and if there's history of recent weight loss or loss of appetite, if she's anorexic, if she has night sweat, or if she has fever. However, the patient denies all of that and says that she's fit and well. The only thing that she's bothering her, you will just do a thorough examination just to have an idea if there is any other organs. Say, for instance, you examine her abdomen for organomegaly, neurologically as well. If there is anything doesn't seem right, you will arrange for a swab from this discharge, which came up with the staff auris. You will arrange for certain blood investigation, routine ones, full blood count, urine electrolyte, LFT, coagulation factor, thyroid function test. All of that came back normal. You will arrange for a biopsy, basically, and send to the plastic, of course, if the biopsy came up something sinister. So in this case that I'm telling you about, it's a case study that I read, so I thought to share with you because it could come also, and could be another case in the lab too. So the first thing you need to think of is squamous cell carcinoma. Usually takes years to be bulky, but in this case, obviously, she said it's a recent one, grown very rapidly. So you have to narrow down your differential accordingly. However, the biopsy in this case showed a very rare, aggressive um, blood vessel endothelium cancer, which is called angiosarcoma. So we know this one is a bit, it has a poor prognosis. So usually you will send the patient for a total body scan, including the head and neck, and you will send or arrange for plastics referral urgently for, of course, treatment and restrictive flap operation. So this case, obviously, as she presented late, she didn't come early. You have to act immediately within 2 weeks' time, urgent referral for the cancer, and because it's including the head and neck cancer. So by that, I hope that I covered one of the cases that you might face, especially in an elderly who has presented with a nodule that you couldn't link or understand or find a reason for that, in order just to save time and try to get it treated quickly as soon as possible. Thank you.